Skin cancer accounts for 1 of every 3 cancers diagnosed worldwide, with 80,000 new cases reported in Canada each year. It is most commonly caused by exposure to ultraviolet radiation from sunlight. Although preventable, it remains the most common form of cancer. Researchers from Stanford University have developed a deep learning algorithm that is able to diagnose skin cancer through computer vision. Its accuracy rate matches that of a panel of dermatologists. Companies that have commercialized the use of algorithms for skin cancer detection include SkinVision, which has created a mobile app that allows users to perform self-checkups by taking a photo and receiving a risk assessment within seconds. MySkinPal is another mole tracking app that analyzes images to identify malignant patterns. However, companies can't market these apps as diagnostic tools unless extensive verification is done due to FDA regulations. Companies are unwilling to undergo this testing process, which is why these technologies are currently only used as early detection aids. In the future, an app that can replace dermatologists is a possibility as algorithms continue to become more sophisticated.
For patients, these algorithms promise faster, more accurate cancer diagnoses. In areas where healthcare is inaccessible, they can increase individual autonomy. However, before this technology matures, patients may be tempted to overly rely on the instant gratification of apps and avoid seeking professional advice. Physicians will need to examine their evolving role as medical authorities. Although some are concerned the public can't fully understand deep learning algorithms, the same could be argued regarding the hidden biases that govern human decision-making. As this technology matures, it is possible that fewer doctors will be needed. As a society, we need to determine the legal responsibilities of the application developers. Simply adding disclaimers does not absolve engineers of their ethical duty to the public. Nationally and globally, we will need to update public and private healthcare systems and establish standards for evaluating black box algorithms.
It is the ethical responsibility of app developers to keep personal data collected by the app confidential. However, the app would integrate any skin sample that was shown into its algorithm. If people wanted to stop using the app, they would not be able to withdraw the samples they had already shown to the algorithm. This is an ethical concern regarding a person's right to withdraw consent. Secondly, being able to self-diagnose does not mean a user will seek treatment upon receiving a positive result. So to what extent is the healthcare system responsible for ensuring people seek treatment? Additionally, the danger of false positives and negatives could cause stress or inaction. But who is legally responsible for these potentially harmful mistakes? With more accurate algorithms, concern is growing about apps replacing human jobs. This could cause physicians to feel reluctant to use apps. Another ethical question is to what extent should AIs replace jobs typically held by humans? For example, is it ethical for an AI to be treating someone when it does not understand the Hippocratic Oath?
To tackle the consent concerns associated with providing training data, a recommended course of action is to encrypt the database of skin disease images used to train the algorithm so that there is no link between the identity of the patient and the image of their skin disease. This maintains the expectation of confidentiality, especially considering as there is no option for the providers to withdraw their data once the algorithm has trained with it. From a deontological perspective, encryption protects the autonomy of the patients, ensuring that they are not merely a means to the end of better skin disease detection. However, this encryption would undoubtedly require more financial and human resources to implement, which could lead to higher costs associated with using the app. By extension, equal access to this advanced care could be compromised.
A second negative impact of this technology would be that the algorithms may not always be accurate. In addition, it may decrease the need for doctors, and patients given this new diagnostic tool may not seek medical attention, such as biopsies and other further steps, if necessary. We would recommend that all users be informed that each diagnosis should be confirmed by a medical professional, ensuring that the patient receives accurate medical advice. From a utilitarian perspective, this has positive outcomes, since it contributes to reduced healthcare costs and wait times, earlier diagnosis, and ease of access in remote locations. Possible drawbacks include difficulty in monitoring compliance and ensuring the patient seeks medical attention when needed. Overall, it needs to be made clear that this app is an assistive technology, not a replacement for doctors.